People USA is what's known as a peer-run organization. The mission of People is to educate, empower, and support people that are dealing with mental health and substance use issues, but to offer them the education that can help them support a better quality of life for themselves.
A peer-run nonprofit means that all of our staff have lived experience, whether that's substance abuse, mental health, or trauma, so they have an in-depth understanding of what the person we're serving is going through.
People USA was born out of the civil rights movement when they were starting to deinstitutionalize the big psychiatric centers across the country. And the people that were coming out of the psychiatric centers were now living in the communities. Groups of people got together and started talking about the quality of care that they did or did not receive in the communities and started advocating for better care. Previous, in the 90s, I was hospitalized in a psychiatric ward. And what I learned from that was that people aren't necessarily treated well all the time. When I started working at People USA, it was an opportunity for me to create something that was different. And the best thing I could think of was use a bed and breakfast mentality, provide excellent, compassionate service to people. So the Rose House is a model that I created back in the year 2000. It was created to break the cycle of going from home to crisis to hospital.
The Rose House is a 24/7, 365-day-a-year program. It's a 5 to 7 day stay for people that are in crisis. The purpose of the Rose House is to really help people remain in the community and get the supports they need so that they don't need to be hospitalized. The Rose House also offers people coping skills discussions. We talk about the 8 dimensions of wellness. We do groups for people while there. We connect them to things in the community so that they're able to stay well once they leave the Rose House.
The Rose House is a great place to go because you can go there instead of going to the hospital. Well, you do need a referral, but once you get there, it's a very home-like atmosphere. It's not very stoic or it's not scary, and the people there have been so great to me. The staff there is amazing.
Dutchess County has built a tremendous relationship with People USA. It's collaborative. Our community has been transforming mental health services for generations. What People USA helped us to acknowledge was a new approach, one that is people-centered. Our Stabilization Center is a model for the country and brings together the important resources to address mental wellness and to give people 24 hours a day, 7 days a week, the opportunity to walk through those doors, to call us up, to text us, and express what they're feeling, what they're experiencing.
The Crisis Stabilization Center is a 23-hour, 59-minute crisis stay for a wide range of reasons. Again, similar to the Rose House, it's anyone that's in crisis. It's the first step to the next step. So the whole purpose of the Stabilization Center is to get people assessed and referred. So it's detox, inpatient, outpatient, reconnected with their providers, whether that's case management, a care coordinator, or even Rose House for a crisis respite.
The Dutchess County Stabilization Center, it's a great resource for us as officers. It gives a place for people to go to, instead of being hospitalized or waiting in an emergency room, it gives them that immediate care and it gives them more. So it's not just dealing with that initial reason they went there, it actually offers more resources and a follow-up. So it's great to have them be able to go through the whole process, and it really connects them with the links and the agencies that they need to go further with their help.
The 3 largest mental health institutions right now today are Rikers in New York, Cooks County in Chicago, and Los Angeles County Jail in Los Angeles. That's not right.
The People USA Forensic Mobile Crisis Response Team is a mobile unit that responds to police and court requests for intervention with individuals in the community. This program, what it does is it tries to partner with this individual, connect them to services within in the community, and help them to, connect to those services that will better help them with their recovery and wellness, and at the same time, help them to avoid getting incarcerated by the courts or being arrested by the police.
It's all about people and understanding people. And a lot of the calls that we're dealing with and being called out to deal specifically with people in crisis, whether it be from a psychological issue, or a short-term crisis as in someone maybe finding something out horrible that happened to a family member, and then them, losing their control and us having to come in to try to help them find that control.
The Dyson Foundation considers and is honored that People USA is one of our partners. We consider them a vital link in the safety net services that the foundation generally funds. In addition, we count on People USA to actually provide an alternative and additional perspective to the mental health care system. And the outcomes that we've seen has been reduced health care costs, reduced incarceration rates, and improved mental health and quality of life outcomes.
I think the future of People USA is to continue the work we're doing, to change the paradigm, to work with traditional models of care in behavioral health. So I look at us as disruptive innovators and working in a system that has been very traditional and fixed on illness, and move it towards more of a system that's focused on wellness.